We've all been there, right? You're at the pharmacy and the pharmacist offers you the generic version of your prescription. They say, don't worry, it's the same thing, and you nod. But have you ever had that little voice in the back of your mind ask, what does the same actually mean scientifically? Is it just a casual promise or is it something more? Okay, let's really get into it because that exact question is something scientists and regulators have spent decades trying to answer with an incredible amount of precision. And believe me, the answer is way more fascinating than you might think. So, the official sciencey term for the same is bioequivalence. And look, this isn't just some marketing buzzword. It's a really high scientific bar to clear. It's a formal, rigorous process to prove that a generic drug, that's the test drug, performs in the body in the same way as the brand name or reference drug. All right, so to really get this, we've got to travel back in time a bit to the FDA's original guidance from 1992. This is where they laid out the classic, old-school way to prove two drugs are the same. Okay, to make all the statistics here feel a little less, well, statsy, let's use an analogy. Imagine two master bakers. One makes the original famous brand name cake, the other one comes along with a new, generic version. Now, to prove their cakes are bioequivalent, the first and most basic test is super simple. Does the average slice from each baker taste the same? And that's exactly what this first test does. It's called average bioequivalence, or ABE for short. It's focused completely on comparing the population averages. Basically, scientists get a group of people, give some the generic, some the brand name, and then they just check if the average effect in the body is pretty much the same between the two groups. And this whole thing is governed by the pretty famous 80 to 125% rule. Now, what this really means, in plain English, is that scientists have to be 90% certain that the average performance of the generic drug isn't dipping below 80% or going above 125% of the brand name drug. It's this specific statistical window that defines sameness for the average person. But, and this is where it gets really interesting, scientists pretty quickly realized that just comparing averages, well, it doesn't tell you the whole story. So let's pop back into our bakery for a second. What if, on average, both cakes are equally sweet, but the generic baker is all over the place? You know, one slice is kind of bland, the next one is tooth-achingly sweet. The average is the same, but your actual experience eating that cake, totally different. And this introduces this critical idea of variability. And this visual just nails the problem, right? You can have the exact same average result from two completely different situations. One drug could be incredibly consistent, while the other is just unpredictable. This exact problem is what pushed the FDA to say, okay, we need newer, more powerful tests. So let's jump forward to 2001, when the FDA rolled out new guidance with two new ways of looking at this whole thing to get a much, much fuller picture of what's going on. Okay, so these are called population bioequivalence, or PBE, and individual bioequivalence, or IBE. Let's go back to the cake. PBE is like looking at the whole batch. It asks, is the generic baker just as consistent as the original baker across everybody? Then you have IBE, which gets even more personal. It asks the really important question, is this drug interchangeable for you specifically? Now, IBE measures something with a super technical name, subject by formulation interaction. I know, it's a mouthful, but the idea is actually super simple. It's basically the scientific reason why you might think a generic is great, but your friend swears they can tell a difference. It's this acknowledgement that some of us can react uniquely to even tiny differences between formulations. So here's the bottom line. You can see how we went from one pretty simple question to three questions that get more and more detailed. Average bioequivalence just asks, is the average slice the same? Population bioequivalence adds another layer. Okay, but is the whole batch just as consistent? And finally, individual bioequivalence asks the ultimate question. Will I, as an individual, find them both equally good every single time? Okay, so how do scientists actually run these, ultimate taste tests in the real world? Well, as you can probably guess, it's a really, really controlled process. So a lot of modern studies use this clever setup called a replicated crossover design. In these studies, each volunteer actually takes both the generic and the brand name drug multiple times with a break in between. Then scientists take blood samples and measure key things, like AUC, which is the total drug exposure over time, and Cmax, the peak concentration it reaches in your blood. These numbers tell the real story. And then finally, they apply those powerful statistical tests we've been talking about. So you see, when your pharmacist says a generic is the same, that's not just a casual off-the-cuff remark. It's actually the conclusion of this incredible scientific journey, one that has evolved from just checking the average all the way to proving, with a very high degree of certainty, that two products are truly interchangeable for almost everybody. And, there's this one sentence from that 2001 FDA guidance that just perfectly sums up the entire philosophy. T is the test drug, the generic. R is the reference, the brand name. All it's saying is that the difference between the generic and the brand name can't be any bigger than the normal, tiny difference you'd find between two different batches of the brand name itself. Basically, the generic has to be at least as consistent as the original. And that kind of leaves us with a final thought, doesn't it? The next time you hear someone say two things are the same, I don't know, maybe it's 2 cups of coffee, 2 different brands of tires, whatever, you can ask yourself, yeah, but could they stand up to this level of scrutiny? It really gives you a whole new respect for what that word equivalent truly means.